Is being infertile a taboo subject? Not anymore. April 23rd through 29th is Infertility Awareness Week.
We need an Infertility Awareness Week because it's a way that we, as physicians, as healthcare providers, can make patients aware of the importance of taking a more proactive approach to their fertility, for their desires to be parents someday.
Top-line MD Infertility Specialist Dr. Armando Hernandez-Rey runs Conceptions, Florida in Coral Gables, where his state-of-the-art lab is one of only 28 in the world.
What makes our lab special is that really we have a revolutionary technology called LifeAir that we decided to implement and place into our infrastructure when we were building this laboratory. Across the board, we've seen 15 to 20% increases from just a year ago before we started using our laboratory for IVF.
So who is more likely to be infertile, the female or the male?
Females are much more complex than us guys will ever be, so there's a lot more moving parts, and so with that comes a higher percentage of female-related infertility as opposed to male.
But for both sexes, there are more options to help infertile couples than ever before.
For somebody who's infertile, the rates of success that we have achieved, or that we are achieving now with, for example, artificial insemination or in vitro fertilization, are 3-4 times what they were 15-20 years ago when I was heading into residency and fellowship.
If you suspect you are infertile, when should you see a specialist?
If the female is less than 35 and the couple has been trying for a year, that's the signal to seek the care of an infertility specialist. If the woman is above the age of 35, however, that number drops down to 6 months because, again, the age-related effects that we see on fertility.
As Dr. Hernandez-Rey can prove, he has perfected the art of making beautiful babies.